Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about nephrotic syndrome. The condition which represents this nephrotic syndrome is massive proteinuria, pitting edema, hypoalbuminemia, hyperlipidemia. These are the conditions which represent nephrotic syndrome. Massive proteinuria means there is more amount of protein excretion through urine. That is more than 3.5 gram per day. And pitting edema is seen. Hypoalbuminemia and hyperlipidemia, more formation of lipoprotein as well as lipidemia is seen. How this happens means when there is glomerular injury, there is increased loss of protein. Due to the glomerular injury, there is increased loss of protein as well as inadequate hepatic synthesis of protein. These two causes hypoalbuminemia, and this hypoalbuminemia there is decreased oncotic pressure and urinary loss of antithrombin 3 as well as decreased serum level protein S as well as C. These are seen, and increased synthesis of LDL and cholesterol. Due to decreased oncotic pressure, edema comes and urinary loss and antithrombin 3. Coagulopathy causes, and there is increased level of protein S and as well as C, and increased synthesis of LDL and cholesterol. This causes hyperlipidemia as well as lipiduria. This is how this nephrotic syndrome is caused. Now we will see which are the primary cause as well as the secondary cause of this nephrotic syndrome. The primary cause are idiopathic. The causes are unknown. They are membrane glomerulonephritis, mesangial proliferative glomerulonephritis, mesangiocapillary glomerulonephritis, as well as minimal change disease. These are the caused by nephrotic syndrome, and the secondary cause are the infection. The infection are infective endocarditis, syphilis, leprosy, hepatitis B. These are the infection, and HIV infection, connective tissue disorder like rheumatoarthritis, neoplasm, Hodgkin's lymphoma, carcinomas and leukemias, metabolic like diabetes mellitus as well as amyloidosis. These are the secondary cause. The causes are known, but in primary cause the causes are unknown. Now we will see the clinical features. The clinical features are the earliest sign is periorbital edema and puffiness of the face. There is periorbital edema is seen as well as puffiness of the face are seen. Sometimes general anasarca with collection of fluid in the serous cavity. Ascites. Around the eye there is an edema which is known as periorbital edema, and there is puffiness of face is seen. Sometimes generalized anasarca with collection of fluid. Generalized anasarca means edema all around the body. As well as the collection of fluid in the serous cavity means collection of fluid in the liver which causes ascites. And due to hypoproteinemia, there is impaired immunity. The immunity is impaired as well as there is increased susceptibility to the infections. Coagulopathy, increased chance of venous thrombosis. There is increased chance of venous thrombosis. In hypoalbuminemia, cough, dyspnea and pleural effusion and ascites are common. Investigation. The investigation are urine examination is proteinuria, red cells cause uncommon, and the oval fat bodies may also be seen, and they may be appear as clusters of grapes. There is 24-hour urine. The proteinuria which is 3.5 grams per day. Serum lipid, there is increased LDL and as well as cholesterol level. The serum protein is hypoalbuminemia is seen. Ultrasound of the abdomen may show normal as well as large and small. The large is due to amyloid as well as diabetes patient. In small is in glomerulonephritis. The serum lipid is there is more amount of LDL as well as cholesterol level. In serum protein, the albumin level is low, so it is hypoalbuminemia. In 24 hours urine, there is more amount of protein is excreted in the urine, so there is 3.5 gram per day protein is excreted. Renal biopsies and as well as renal function tests are the investigation of this nephrotic syndrome. Now we will see the treatment. The treatment is edema. Due to edema, the patient should take very low Na plus sodium diet which is 1 to 2 gram per day, as well as good protein diet. Due to proteinuria, the proteins are excreted through the urine, so the patient should take good protein diet if the blood urea is normal. The mild and to cure this edema, thiazides, the diuretics drugs are given. Like for mild cases, thiazide is given. For moderate cases, loop diuretics are given. For severe cases, loop diuretic as well as diuretics are given. In hyperlipidemia, there is exercise and diet. The triglyceride as well as cholesterol level gets increased, so exercise and the diet are the major concern. Atorvastatin 20 mg once or twice a day. Corticosteroid and immunosuppressive therapy is given. And the control of the specific infection, as I have said, the secondary cause is due to the infection like infective endocarditis and syphilis. These infections should be controlled. Anticoagulants are given. And the treatment of the underlying disease. The treatment, which diseases cause this nephrotic syndrome, that diseases should be treated as soon as possible. And these are the treatment of this nephrotic syndrome. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt in it, please do comment it. If you want any other topic, please do suggest in the comment box. Thank you.